Scientists have known for decades that paracetamol in large amounts is toxic to the liver, but until now its mechanism of poisoning has eluded them. As well as providing insights into how an excess dose of this common painkiller causes poisoning that can be difficult to treat and can prove fatal, the new findings could also open doors to the development of new drugs for liver damage. Dr. Leonard Nelson, of Edinburgh University, said, "Paracetamol is the world's preferred pain remedy. It's cheap and considered safe and effective at therapeutic dose. However, drug-induced liver damage remains an important clinical problem and a challenge for developing safer drugs. Our findings reinforce the need for vigilance in paracetamol use and could help discover how harm caused by its adverse use might be prevented." The study, published in Scientific Reports, looked at the impact of paracetamol on liver cells in human and mouse tissue. Experiments showed in certain settings the drug can damage the liver by harming vital structural connections between adjacent cells in the organ. When these cell wall connections, known as tight junctions, are disrupted, the liver tissue structure is damaged, cells are unable to function properly and they may die. This type of cell damage is known to occur in liver conditions including hepatitis, cirrhosis and cancer, but until now it was not linked to paracetamol toxicity. The researchers now aim to develop a reliable method of using human liver cells as an alternative to animal testing. They then will seek to examine how varying paracetamol doses and timescales affect toxicity in the liver and identify potential targets for new drugs. Co-author Dr. Pierre Bagnaninci said, "Although liver damage caused by paracetamol toxicity has been the subject of intense study for 40 years, recent developments in biosensor technology are enabling a fuller picture of the biological mechanisms involved." Paracetamol is an effective treatment for mild to moderate pain and fever in adults and children, when used as directed in product information. The maximum dose within a 24-hour period must never be exceeded. Even taking 1 or 2 more tablets than recommended can cause serious liver damage and possibly death. Paracetamol overdose is one of the leading causes of liver failure. Adults can usually take 1 or 2 500 mg tablets every 4 to 6 hours, but shouldn't take more than 4 grams, 8 500 mg tablets, in the space of 24 hours. Children under 16 need to take a lower dose, depending on their age or weight. Check the packet or leaflet, or ask a pharmacist or doctor for advice. For very young children, paracetamol liquid is given using a measuring spoon or an oral syringe. Serious paracetamol overdoses occur twice as often in Britain than the rest of Europe. Paracetamol-linked liver failures, so severe that the patient needs a transplant, happen in the UK 8 times more than in Holland, twice as often than in France, and 66 times more than in Italy. Last year, a study of 7 countries commissioned by the European Medicines Agency found only Ireland came out worse than Britain. Paracetamol overdoses represent 20% of liver transplants across Europe, but rise to 52% in Ireland and 28% in the UK, dropping to 1% in Italy. What is acute liver failure? Acute liver failure is a rare condition. It happens when your liver suddenly starts to not work. This often happens right after an overdose of medicine or poisoning. Chronic liver failure happens over a long stretch of time. What causes acute liver failure? Taking too much acetaminophen causes most cases of acute liver failure. Acetaminophen is a painkiller found in many over-the-counter and prescription medicines. Certain diseases can also cause acute liver failure, such as hepatitis and Wilson's disease. In some cases, the cause for liver failure is unknown. Who is at risk for acute liver failure? You are at risk for acute liver failure if you take too much acetaminophen, have certain diseases or infections, such as hepatitis, Wilson's disease, and herpes simplex virus. Drink a lot of alcohol. Have poor blood flow to the liver. What are the symptoms of acute liver failure? If you have acute liver failure, you may have symptoms such as diarrhea, discomfort on your right side, just below your ribs, fatigue, loss of appetite, nausea. As the disease gets worse, you may also become confused and very sleepy. Other symptoms include bruising or bleeding easily, jaundice, a yellowing of the skin and whites of the eyes, vomiting blood, buildup of fluid in your belly, abdomen. How is acute liver failure diagnosed? Liver failure is a serious condition. It requires medical care right away. Your healthcare provider will ask about your past health, your use of medicines or illegal drugs, and any possible exposure to toxins. You will also need a physical exam. Your healthcare provider may check for signs of hepatitis, such as jaundice, fatigue, and abdominal pain. You may also need tests for mental alertness. Blood tests. These check your liver enzymes and bilirubin levels. They also measure your blood's ability to thicken, coagulate. This is called prothrombin time. Imaging tests. You may have a CT scan or MRI. These check your liver. How is acute liver failure treated? Treatment for acute liver failure depends on the underlying cause. If your healthcare provider thinks you took too much acetaminophen, you will probably be given activated charcoal. Taking this will help your body lower how much medicine is absorbed in your gastrointestinal tract. Or you may take N-acetylcysteine. This medicine can also help with an acetaminophen overdose. You can take this medicine either by mouth or through your vein. It is also sometimes helpful to people with acute liver failure that was not caused by too much acetaminophen. If viral hepatitis is the cause of your acute liver failure, your healthcare provider may give you certain medicines depending on the type of hepatitis you have. If you have autoimmune hepatitis, your healthcare provider can treat you with steroids. If your healthcare provider can't find the cause of your acute liver failure, you may need a liver biopsy. This test can give more information about your liver. It can also help your healthcare provider decide on treatment. If treatment can't get your liver working again, you may need a liver transplant. Good candidates for transplant are strong enough for surgery. They don't have underlying cardiovascular disease, severe infection, or other diseases, like AIDS. But people with controlled HIV can get a liver transplant. If you are approved for a liver transplant, your name will be put on a waiting list to get a donated organ. People with the most urgent need are placed at the top of the list. While you are waiting for a liver to become available, you may be able to have some therapies to keep you alive.